Hello, my name is Beth Therese, and I am a trauma nurse clinician at VCU Medical Center. And today I'm going to talk to you about the impact of a motor vehicle collision, or MVC, on the body. So there are different types of injuries you can have when you are in a motor vehicle collision. The first one is that it could be blunt trauma, a little less obvious than penetrating or burns, and that you can have massive internal injuries and we not see them when you come in. With penetrating trauma, that can occur from flying objects in the car. It can occur from objects such as poles or posts coming into the vehicle and striking the occupants of the vehicle. When it does that, then you could have lacerations, you could have cuts from anything in the car that becomes damaged, can injure you, or you can get penetrating trauma when you have an ejection, which means you are thrown out of the vehicle. You can also have burns in which you are in a motor vehicle collision and the car catches on fire. One of the most memorable cases I can remember are four young men that were out partying one night, and the driver ran into a large tree. The vehicle caught on fire. Three of the four young men were able to get out of the car. The fourth one was not able to get out of the car. He was pinned in the car, and unfortunately his friends heard him screaming as he burned to death. So, needless to say, we certainly don't want that to happen to any of you. So the other thing that you have to think about with the motor vehicle collision is not just the impact of the car coming in contact with whatever it stops with. So, we call that the first impact, when the car collides with something. And the faster the vehicle is traveling, the more damage that is done and the more injury that occurs to the person. And, it's that sudden stop that can do a lot of the damage. So what happens is the vehicle collides, and then any of the occupants that are in the car will collide with something. They can collide with the seat belt, they can collide with the airbag, and that's another opportunity for burns. Is occasionally patients will, or people will get burns from the airbag because it deploys so quickly. If they are not restrained, then they collide with the steering wheel or with the windshield. We've had a number of patients that break the steering wheel and end up having blunt cardiac injury because of the damage of hitting the steering wheel as they go forward. And then the third impact is the fact that the organs inside your body keep traveling. So the car stops, your body keeps going, and then your body collides with something, and then all of your internal organs will keep going until they collide with something. And that's where you get the blunt trauma to the chest. And you can see in this picture here where the organs go forward and they hit the sternum, and that's where you can get heart damage. You can also get brain damage from the skull going forward. When it stops, your brain keeps going and it collides with the inside of your skull, and you can have brain damage from that. The path of the vehicle also makes a difference. If you are in a front end collision, then what happens is your body can go up and over. You can hit your head, chest, your abdomen, or you can go down and under, and that's when they go under the dash. And that's when some of our patients get pinned, is they get pinned from going down and under. And what that can do is it can injure the legs and break the pelvis. In the picture here, you can see where you've got the hip fracture here, but you've also got a pelvis fracture. And this is a pretty serious pelvic fracture that's going to take a long time for somebody to recover from. If you get hit T-boned, then you can injure your aorta, which is the major blood vessel coming off of the heart. You can break a clavicle, which is up in the chest. Again, you can injure your pelvis. You can also get head and neck injuries. And with rotational injuries, that's where the car gets hits and spins around. And for those of you that are NASCAR fans, you've probably seen that in NASCAR with cars, and the speed certainly plays an impact there. And so you can get the front end collision or the lateral, any of those damages can occur, or injuries can occur. So the other possibility is if you get hit from the rear of the car, and what happens is you get propelled forward until you hit something, and then you come back, and that's where patients get whiplash. And cars have gotten more sophisticated in safety mechanisms over late years, because you can see in the picture here where the head goes forward and then it snaps back. And now cars have headrests to prevent your head from going too far back and severely injuring that neck. And again, for those of you that are NASCAR fans, you know, they have the Hans device, which is to protect the head and neck in the case of a crash. And that bore out of a serious car collision with Dale Earnhardt, in which he was killed because of that. He was restrained, but his head was broke his neck. And then in a rollover, that's can get any of the previous things that I've discussed. And about a third of the occupants, unfortunately, are killed in a rollover. If you are ejected, that could be because you're not wearing a seatbelt, and that has even higher death rate. And the picture that you see here is from a young man that had a serious neck fracture, and he ended up in a halo and a vest here, and they have to wear that a prolonged period of time. And without it, there's the danger of them becoming permanently paralyzed. So what happens first off is you know, EMS is going to get to you. First of all, let me just back up for a second. If you're in a car accident, stay in the car. Keep your seatbelt on, because we've also had patients that took, you know, rear end collision. They rear-ended somebody. Gentleman took his seatbelt off to get out to inspect the damage, and then somebody rear-ended him, and because he was unrestrained, he went through the windshield and broke his neck. So please, please, if you are in a car accident, first thing you want to do is stay there, call 911, get EMS coming. They will get you out of the car safely. Don't worry about anything else. Don't call your parents, call 911 first, okay? So that they can make sure the scene is safe and protect you to get out of the car. Unless, of course, the car's on fire, at which point you need to get out of the car. So EMS is going to get there, and what they will do is they will put a C-collar on you to, you know, protect your neck, just in case you've got any type of injury to your neck. We don't want you to have further damage by moving your neck around too much and then become paralyzed. They will strap you to a stretcher. And again, it's to minimize movement to prevent further injury. If they see any uncontrolled bleeding, then what they will do is they will put a tourniquet on. And you can see in the picture here with this gentleman, he's sitting in a chair, but he's got a tourniquet on his leg, and that's to stop you from bleeding to death. I encourage you, if you've not taken first aid and learned how to put a tourniquet on, that you do that. You know you've got the tourniquet on properly because the patient will say it hurts if they are able to speak. And the idea is to keep them from bleeding to death. Once you get to the trauma bay, you will be surrounded by people. Usually there's 10 to 15 people that will surround the stretcher. EMS will tell us what is going on, and then we are going to cut every stitch of clothing that you have off, because what we want to do is find out if you have any injuries that we hadn't, you know, EMS hadn't identified, and we need to be able to identify all of those injuries. So we will cut everything off, inspect you from head to toe, front and back, and then cover you up with some warm blankets. It is a large team, like I said, that will take care of you in the trauma bay. So if you're not breathing adequately, then we will put a tube down your throat into your lungs and connect you to a breathing machine called a ventilator. We will always try to maintain that airway first, unless you're bleeding, at which point we will stop the bleeding first and then we'll maintain. But in the trauma bay, that we've got enough help that we're going to be doing things simultaneously. So like I said, you'll be swarmed with people. You can see here where we're in full protective gear. That's what you will see when you come in, is everybody having on what we call PPE, or personal protective equipment. We'll start IVs on you, give you fluids, or if you need it, if we think you're bleeding, we'll give you blood. If you are unstable, then you're going to go straight to the operating room. If you're stable, then we will take you to a CAT scanner or a CT scanner, and we're going to scan you from head to toe, looking for any type of injuries internally. Some possible interventions that you can have in the trauma bay. If you have a collapsed lung because of broken ribs or you crush your rib cage, then we will put a chest tube in, and that's what you see in the picture. Here's a large tube that goes into the side of your chest, and we connect it to a device that sits on the floor. Again, like a tourniquet, it hurts, but it will save your life. If you have broken bones, we will put you in splints or tractions that will decrease your pain, but it'll also decrease any bleeding internally until we can definitively fix the bones. You may go to the operating room, or depending on the circumstance, we may send you to the floor or the intensive care, depending on the severity of your injuries. So the important thing is, don't let it happen to you. This is a picture of a trauma bay, and you can see all the different people. You've got EMS there, and they're getting the patient onto the trauma bay stretcher. So drive safely, be safe, keep your seatbelts on.